I'm a second-year medical student. Nice to meet you. As part of my learning, I've been asked to conduct an examination of your heart today. So the deflection involved, first of all, you're removing your clothes from the waist up. I'll then need to have a look at your hands and face, and have a look and feel of your chest, and have a listen to my stethoscope to get a general idea of how your heart's doing. It shouldn't be painful, but if it is, please stop at any point. Does that sound okay?
Yep, that's fine.
Okay, if you'd just like to remove your shirt from me, I'll just go and wash my hands.
Okay.
I'm just going to comment to the doctor as I go along, so
Yep, that's fine.
if you'd like to do your time. I'll just pop that into the chair for you. Okay, so if you just lie back, what we'll do first is just make sure you're at 45 degrees. Okay, and now lie back. Are you comfortable there?
Yeah, that's fine.
Good. Okay, so on inspection, first of all, around the bed, there's no signs of any bedside medication, there are no walking aids, and no oxygen cylinders that are being used. The patient themselves appears quite well confused, not in any obvious discomfort, not sweating or pale, not in any pain. Do you have pain in the hands?
No.
Can I have both hands, please? Okay, the hands feel warm, look well perfused. Nails themselves don't show any signs of splint hemorrhages. No Janeway lesions on the back dorsum of the wrist. No signs of any nicotine staining. Can I ask you to put your fingers like that for me, please? Just press them together. Just take a look through them. Good, so the angle of the nail bed's preserved, so it doesn't appear to be clubbing. That's fine. You turn your hands over. Okay, so now Osler's nose on the fingertips. That's fine. Okay, I just need to feel for the pulse in both your wrists. Okay, so those are in sync. And one thing I'll quickly do is quickly refill. Okay, so that's less than 2 seconds, which is normal. I'm just going to take your pulse now.
Do you mind lying down for me, please? Lie down?
Yeah.
I'm just going to take your hand and support it, okay?
Okay, can I just relax your hand across your chest for me?
Lift the hand up, and then lift the patient's arm to the horizontal and tap in the tail of the crest. So the reason why you hold it up is that so that you can actually get into the axilla and tap in the tail. Then repeat on the other side. Characterize in detail any lumps. You don't have a feel.
Okay, that's good. So pulse is 64 beats per minute. It's regular. At the radial pulse, you can assess the rate, volume, and regularity of the pulse. The pulses are in sync. I normally proceed to blood pressure at this point, but I'm going to carry on. Just going to look at the eyes now. So no corneal arcus, no xanthelasma around the eyes. Just going to pull down your eyelid. Okay, no pallor of conjunctiva. There's no signs of any malar flush, which would point towards mitral stenosis. Can I have a look at your in your mouth, please? If you just like to open your mouth and lift up your tongue. Just going to have a look inside. Okay, so no central cyanosis, and also assessing so dental hygiene, which is good. So no risk factors for particular bacterial endocarditis so far. Have a look at the neck. I'm just going to feel for the pulse in your neck. So this is the carotid pulse, medial to the sternocleidomastoid.
And then this mass.
Okay, so that's on both sides.
Just above the adrenal. And the nipple of the left.
Okay, it's a good strong pulse. So can I ask you just to relax your head back and look towards that side for me, please? Okay, so I'm just going to get down the horizontal level and look at the base of the neck between the heads of the sternocleidomastoid. Look across the
4 centimeters.
base of the neck. You see a slight pulsation here. Just going to confirm it's the JVP.
And the surface
Secludable, non-palpable.
well defined.
If I wanted to, I could consider a hepatojugular reflux. But I'm fairly certain that's the JVP, so I'm going to measure the vertical height between the pulsation and sternal notch.
It's hard.
So that's 3 centimeters, which is within the normal range. The JVP is not raised. Now, looking at the chest, closer inspection of the chest reveals no midline stenotomy, there's no cardiac surgery previously performed, no pacemaker scars. No chest wall deformities such as pectus excavatum, and no visible pulsations. Do you have any pain in the chest? No. Okay, so I'm just going to put my hands across the chest. Okay, so performing the Z maneuver.
Particularly when you're feeling the mass there, so you need to pat it down quite
Good.
firmly.
I'm just going to feel for the apex beat, starting inferior-laterally.
Do you feel like the way we do the abdominal?
And localize with one finger.
All the 4 quadrants systematically, so that you don't need any area.
Good. Now I'm going to assess that in terms of the rib spaces. So second, third,
there's a mass there which is very small.
fourth, fifth intercostal space. Let's say the mid-clavicular line, which is considered normal, so the apex beats are not displaced. I'm now going to have a listen with my stethoscope.
It's thickening of the skin.
So that's one with the bell at the apex. I'm just going to feel for the pods at the same time so I can make sure I can identify S1 and S2.
And then there's a mass in the alveolar area. The shape of the mass is
Listen to the low at the left sternal edge, the tricuspid area.
It's quite
You want to warm the patient first.
okay. Sorry. Do you mind if I explain? I feel the mass
No,
into detail.
I mean, put your hand by your side and then don't ask
Second left
at the same
intercostal
time.
space,
Put your hand
the
by your side
pulmonary
and
area.
patient like that. As well.
I'm going to feel the mass.
This is where you're most likely to hear physiological splitting.
Outer
So you need to
quadrant of your
determine whether the splitting is affected by inspiration and expiration.
the size and shape of the breast.
No. The thing is, if the mass right here, you need to just feel it. But because
Second
it's around the
right
areola,
intercostal
you want
space,
to
the
feel
aortic
it.
area.
Ask her, I want to feel around your areola.
Yeah.
Would that be alright?
I'm going to feel around your nipple and
Okay, good. Now, what I'd like you to do is, can you roll over away from me, just onto your left-hand side slightly? Just stay there for a second. Listen for radiation to the axilla.
it's hard. The surface is well demarcated.
Okay, that's fine. If you'd just like to sit up for me, please. So mitral murmurs would radiate to the axilla, and now aortic murmurs.
Feel for this mass.
You just take a deep breath in, deep breath out, and hold it there.
Yeah, and then you do want to push
listening
down around
expiration.
and traffic into the axilla.
Alright, now listen to the mass here.
For the tail.
Feeling for
Good.
the lymph node.
Okay, you can breathe again.
There.
This is the carotids for any carotid breweries.
You're the one who's doing after me, free.
Yeah, but there's nothing like tail.
With the tail of the breath, it goes like this. There's a bit of soft tissue, subcutaneous tissue, right? So it goes underneath the area and it's like
the base.
So the tail of the breath goes into that smell. It's very important to be able to feel the tail because that's, some of the process.
So no basal crackles.
Breath carcinoma.
I'm telling you all the pathology there
Where?
in this breath.
Good. So press against the sacrum. Sacral edema.
Then,
No sacral edema, it's just like to lie back.
and then
Do you have any pain in your legs?
No.
Your legs?
Supraclavicular. Do you mind if I feel for the
Trouser legs. Okay, so first of all, inspecting stenosis gallans. To indicate removal of the saphenous veins.
So,
Pressing against bony prominence.
is there a mass there?
No proof of edema either. That's great. Thank you very much. That completes my examination. Thank you for being so patient. I should like to get dressed and I'm going to go wash my hands to report my findings to the doctor. Are you comfortable?
Yeah, fine.
Do you have any questions?
No.
Good. Okay. Thank you very much. Okay. So further tests I might want to do, if warranted, for a patient showing cardiovascular signs would be to perform a full peripheral vascular exam. I'd also like to look at ECG and chest X-ray in this patient.